Welcome to the deep dive. Today we're tackling a challenge many of you with dogs and cats probably know all too well,
Mm,
that often really stressful world of veterinary visits. We've got a very comprehensive guide as our foundation today,
yeah, a really useful one.
and we're going to focus in on why our pets, our companions, can become so fearful or sometimes even aggressive when they're supposed to be getting help.
Exactly. And it's a situation that can make even the most dedicated pet owner feel pretty helpless,
Right.
right?
So,
So our aim with this deep dive, it isn't just to say, yeah, it's stressful. It's more to pull back the layers, try and understand the core reasons, the why behind these behaviors.
okay.
Because if we can get a handle on that why, then we can unlock, hopefully, more effective ways to make those vet trips better for the animals, for you, and, for the vet teams trying to care for them.
Right. Good point. And just so we're all starting from the same place, let's quickly define what we mean. So, fear in this context, it's not just being a bit nervous, is it?
No, not at all. It's more involuntary. A real negative gut reaction to something they perceive as a threat or even just anticipate might be a threat.
Okay. And then there's aggression.
Right. Which is often, a signal. It's communication. A way an animal tries to maybe create space or warn someone off, basically prevent harm when they feel threatened.
And there's a link there, usually.
Oh, a huge link. It's so important to remember that aggression very often is really a symptom. It grows out of that underlying fear.
Ah, okay.
When an animal feels trapped or scared, aggression can be their tool, their way of trying to regain some control. Recognizing that connection is, well, it's the crucial first step, really.
Got it.
So our goal today is basically to equip you with those insights so you can be an even better advocate for your pet and, hopefully help make those vet visits calmer all around.
Okay, let's dive into that then. What's really at the heart of this fear and aggression in the vet's office? I mean, it's not like our pets just decide they don't like vets, right?
No, definitely not. A really big part of it just comes down to, well, how their brains are wired and how they learn. Think about classical conditioning.
Okay. Like Pavlov.
Sort of, yeah. But in this case, one scary poke, maybe one painful injection, can essentially turn the entire clinic, the sights, the smells, everything, into a giant danger signal in your pet's mind. That's the power of negative association. A single bad experience can forge this really strong, lasting, negative link.
So the environment itself becomes the trigger.
Exactly. The sounds, the smells, even the feel of the cold table,
Yeah.
it can all instantly set off those fear memories.
Hmm.
And that leads to, a defensive reaction. Their sympathetic nervous system just kicks into high gear, fight or flight.
That makes perfect sense. So the white coat effect is actually, well, it's a real learned response.
He really is.
But is it always about specific bad experiences? Or are some animals just, I don't know, born more anxious?
Well, there's definitely a genetic piece to the puzzle. Just like with people, some animals do seem to have a sort of built-in tendency towards being more fearful or having a more, let's say, reactive temperament.
Okay.
So yeah, while those negative experiences are a huge factor, sometimes an underlying predisposition can make certain animals more likely to develop these anxieties in a vet setting. It's nature and nurture.
Okay, so we might have a naturally sensitive animal walking into what could be a pretty overwhelming place. What are the typical triggers, the things in the vet setting that often set off fear or aggression?
Well, those past negative experiences are probably the biggest one, like we said. Frightening procedures, painful ones, maybe even handling they just perceived as rough or scary. That leaves a mark.
Right.
But it can also be more immediate stuff. The stress of just getting there in the car or
Yeah.
carrier.
The journey itself.
Absolutely. Then maybe bumping into other stressed animals in the waiting room or
Yeah.
even just being approached by strangers, the vets, the techs, even if they mean well,
Even if they're gentle.
even if they're gentle. And like we touched on, if the pet already has an anxious personality or maybe other behavioral issues going on, that can really turn the volume up on the whole problem.
Wow, it really can sound like a perfect storm sometimes, can't it?
It can feel that way.
A sensitive animal surrounded by potential stressors, maybe reminding them of past bad times. Are there specific risk factors, things that make it more likely an animal will show these behaviors?
Yeah, definitely. A big one is a history of fearful behavior, either at previous vet visits or maybe just generally being anxious around new people. That's a red flag.
Okay.
Also, poor socialization during those really crucial early weeks. For puppies, it's roughly 3 to 12 weeks. And for kittens, it's even earlier, like 2 to 7 weeks.
That critical window.
Exactly. If they didn't get good exposure then, They might be less equipped to handle new, potentially scary situations later on.
Makes sense.
And unfortunately, harsh handling, especially when they're very young puppies or kittens, that can also seriously increase the chances of fear and, defensive behaviors down the road.
Okay, this is all incredibly helpful background. So now, before we can even think about fixing things, we need to be able to spot the problem, right?
Yeah.
Recognize when our pets are actually feeling scared or anxious. It's not always obvious, is it? Like growling or hissing.
No, definitely not. And that's such a critical point. Often the very first signs are really subtle, easy to miss if you're not looking.
Like what?
We call them displacement behaviors. Things like yawning when they're clearly not tired, or licking their lips when there's no food around. Maybe grooming themselves suddenly and intensely, even if they're clean. Or panting when they're not hot and haven't just exercised.
Okay.
These little things, they can be their way of sort of coping, but they signal, hey, I'm feeling stressed here.
Those are definitely things you could easily overlook or just think, oh, he's tired.
Yeah.
So what happens if the stress keeps building? If it goes beyond those quieter signals?
Well, as their fear or anxiety ramps up, we might start seeing the more commonly recognized signs. But you can think of it in terms of the 4 Fs of behavior.
The 4 Fs. Okay.
Yeah. Fight, flight, freeze, and fidget.
Okay. Fight and flight seem obvious.
Right. Fight is, trying to bite, scratch, snap, actively defending themselves. Flight is trying desperately to get away, escape, hide under a chair, anything.
And freeze?
Freeze is when they just become completely still, almost like they shut down. They might seem unresponsive, very tense. It's easy to mistake for calmness, but it's actually extreme fear.
Wow. Okay. That's important to distinguish. And fidget.
Fidget can look like restless pacing, maybe whining, trembling, just general agitation. Can't settle down.
Got it. Fight, flight, freeze, fidget.
Yeah. And the key thing to remember is that any change from their normal behavior or how they usually act in that vet environment is worth paying attention to.
Right.
Changes in where they are, who they're interacting with, what procedure is happening, even just a different person coming into the room.
Well,
all these things can shift their emotional state pretty quickly.
okay, so we're getting a clearer picture of the why and the what to look for. Now let's flip this. Let's talk solutions, or at least improvements.
Yeah.
Our source material digs deep into how the clinic itself, the environment, and the people can make things better or worse.
Absolutely. And this is where proactive changes can make a huge difference. Let's start just with the physical environment. Think about it from your pet's perspective. What are they seeing, smelling, hearing, even feeling?
Okay.
So first off, minimizing known triggers. That could mean things like separate waiting areas for dogs and cats, if possible, or just reducing visual clutter. Maybe fewer bright flashing lights, less sudden movement.
Calming things down visually.
Exactly. And noise is another huge one, just keeping the overall sound level down. The source even mentions that stress can start kicking in around 85 decibels, which isn't actually that loud.
Like a busy street, maybe.
Yeah, or loud machinery. And believe it or not, temperature matters too. They actually give specific comfort ranges like 65 to 79 Fahrenheit for dogs and slightly warmer, 70 to 81 for cats.
Wow, that's specific. I wouldn't have guessed temperature was such a factor.
It all adds up to the overall sensory input. Beyond that, things like using pheromone support adaptal for dogs, Feely-Way for cats can be really valuable.
Those diffusers you sometimes see, do they work?
They can definitely help. They release synthetic versions of calming pheromones, essentially sending safe signals to the pet's brain, helping reduce that background level of stress.
Okay.
And interestingly, while having the owner present can be comforting for some pets, for others, it can actually make them more anxious. Sometimes they feed off our stress or become more protective.
Ah, good point. What else about the environment?
Food. Using really tasty, high-value food, not just kibble, but like cheese, chicken, special treats. That's huge for distraction and for counter-conditioning, which we'll talk more about. And simple things, like having comfortable non-slip mats on exam tables and providing safe hiding places, especially for cats. Even just covering their carrier with a towel can help.
It really sounds like a lot of small, thoughtful details can make a difference.
They absolutely can.
Okay, so that's the physical space. But obviously, it's not just the room, it's the people in the room. The source really hammers home how important it is for staff to read animal body language.
Oh, fundamental. Absolutely fundamental. The vet team's ability to accurately see and interpret what a pet is telling them through their posture, their ears, their tail, that's key to preventing things from escalating.
Spotting those subtle signs we talked about earlier.
Exactly. Spotting them early allows them to adjust their approach in real time. And staff need to be super conscious of their own body language, too.
How they move.
Yeah. Things that seem normal to us, like making direct eye contact with a fearful animal, or bending directly over the top of them, or putting your face close.
It'd be really scary for them.
Totally. Perceived as very threatening. So instead, adopting less threatening postures, like bending at the knees instead of the waist, turning slightly sideways, maybe squatting down.
Appearing smaller or less intimidating.
Precisely. And absolutely no sudden movements. No reaching out quickly to grab. The ideal is always to encourage the animal to approach voluntarily, if possible. Lure them with treats, perhaps.
And you mentioned different approaches for cats versus dogs.
Yes, definitely some important species-specific tips. For cats, for instance, use a soft, quiet voice. Maybe tap the surface gently to invite them forward.
Instead of pulling them out of the carrier.
Right. Take the top off the carrier if you can, much less stressful. Let them sniff you first. Start petting gently, maybe just under the chin initially.
Yeah.
Petting down the whole body, especially past the shoulders, can sometimes be too much for a stressed cat.
Okay, and for dogs?
Similar principles.
Yeah.
Approach maybe with your hand held loosely at your side, not reaching over their head. Gentle patting on their leg or chest if they seem receptive. Soft verbal encouragement, offering a treat from an open palm.
Let them sniff first.
Always let them sniff first. Gentle petting under the chin or on the neck is often better received than petting over the head. And again, slow, deliberate movements are key for both.
It sounds like it requires a lot of patience and awareness.
It does. And understanding their social distance, their personal space bubble, respecting that is huge. Don't crowd them, especially if they're showing signs of stress. Approach from the side or slightly behind the shoulder if you need to get close.
What about just the general noise level of the staff?
Keep it down. Avoid loud talking or laughing right near the animal. Work quietly, efficiently. And importantly, staff need to recognize their own fear or anxiety too. If a staff member is scared, the animal will pick up on it, and it's safer for everyone if they ask for help.
That's a really good point about staff recognizing their own feelings. The source also mentioned avoiding adversarial language. That stood out.
Yes, hugely important. The words we use shape how we think and act. Calling a pet mean or vicious or bad, it sets up a confrontational mindset.
Instead of seeing them as scared.
Exactly. Using accurate, empathetic language like fearful, anxious, painful, confused encourages more understanding handling. And it goes without saying, but the source is very clear, absolutely no punitive actions, no punishment. It just increases fear, increases aggression, and makes everything more dangerous because the animal might stop giving those warning signs.
Right. It shuts down communication.
Precisely.
Okay, so all this awareness and careful approach seems to lead naturally into the idea of a personalized handling plan for each pet. What does that actually look like?
Yeah, a handling plan is basically a custom strategy. It's tailored for that specific animal, considering their history, their known triggers, their likely temperament, and what actually needs to be done during that visit.
So what goes into it?
Well, key things are figuring out if the patient will take food and what kind those high-value treats for counter-conditioning. Then deciding on the lowest level of restraint that's still safe and effective.
Least restraint possible.
Always. And choosing the right handling tools for that specific pet and situation. A big part is also prioritizing. What procedures are absolutely essential today? Can we do the least stressful things first?
Order matters.
Definitely. Maybe break it up into multiple shorter visits if the animal gets overwhelmed easily. And, crucially, every good plan includes thinking ahead about chemical restraint, sedation, or anesthesia.
Planning for it just in case.
Or even planning to use it from the start if the pet has a known history of severe fear or aggression. It's often much kinder and safer to sedate early before they get highly distressed.
That makes sense, being proactive. And you mentioned counter-conditioning again. That seems like a real cornerstone here.
It really is. Counter-conditioning, or CC, is super powerful. It's basically using that classical conditioning principle we talked about, but flipping it.
Turning a negative into a positive.
Exactly. Changing that fearful emotional response to the vet clinic or to being handled into a positive one. And like I said, offering really delicious food is the easiest, most effective way to do that.
How does the timing work?
You give the treats when the animal is relaxed and feels safe, ideally. Then you continue offering them just before, during, and immediately after anything potentially unpleasant like an exam or an injection. The goal is to build a new association. Vet clinic means yummy treats.
So the food becomes the predictor of good things, not bad.
Precisely. And food can also be like a barometer for their stress. If a pet who normally loves treats suddenly stops eating them,
That's a sign they're getting overwhelmed.
big sign, time to pause, reassess, maybe change the plan.
So food isn't just bribery, it's communication. Okay. Now, even with all these great techniques, sometimes physical restraint is still needed, right? The source had some specific guidance there.
Yes, and the absolute #1 rule is always use the minimum amount necessary. Less is more.
Because restraint itself is stressful.
Hugely stressful for many animals. So when you do need it, the goal is firm, balanced pressure, good support for their whole body.
Hmm.
Controlling the head and the rear end is usually important to prevent injury. For dogs, specifically putting them on their side, lateral recumbency can feel very vulnerable and threatening, so it should really be reserved only for procedures that absolutely require it. Many things can be done with the dog standing or sitting, which is often less stressful.
Good to know. What about cats and scruffing?
Yeah, scruffing gently, holding the loose skin on the back of the neck. It's sometimes necessary, but it should only be used on cats who are known to be okay with it, and really only when needed for specific control, maybe during that lateral recumbency. It's not a go-to for every cat.
Right. And what if the pet struggles?
There's a great guideline called the 3-second rule. If the pet is actively struggling hard for more than about 3 seconds, you stop.
Just stop.
Stop the procedure, ease the restraint, let them calm down for a moment,
Hmm.
maybe offer food again, reassess. If you try again, maybe slightly differently, and they're still highly stressed after a couple of attempts,
Then what?
then you seriously need to consider, is this procedure essential right now? Or would chemical restraint be the safer, more humane option for everyone? Pushing through intense struggling is rarely the right answer.
That focus on stopping and reassessing feels really important. Less force, more strategy.
Exactly.
Okay, now, the guide also listed a whole bunch of handling tools that can actually help reduce the need for that kind of forceful restraint.
Yes, and these tools can be fantastic for increasing safety and lowering stress. We already mentioned pheromones, diffusers, sprays, even collars the pet can wear.
Right.
Muzzles are crucial safety equipment. Basket muzzles for dogs allow panting and drinking, which is great. Soft nylon slip-ons are okay for short periods. And there are special muzzles for cats, sometimes covering the eyes too, which can be calming.
But the key is getting them used to it beforehand.
Oh, absolutely critical. If the owner can work on muzzle training at home, making it a positive experience, that's a game changer for vet visits.
Okay, what else?
Elizabethan collars, the cones, can sometimes help gently control the head. Towels, just regular soft towels, are amazing for gently wrapping and immobilizing smaller pets. Very low stress.
Towel wraps, yeah.
Things like thunder caps, which cover the eyes, can reduce visual stress triggers. Thunder shirts provide gentle, constant pressure, like swaddling, which calms many animals.
Like a hug?
Kind of, yeah. Even playing classical music designed for pets has shown some benefit in calming the environment.
Interesting. What about more intensive situations? Aggressive animals needing treatment?
For unmuzzled, aggressive dogs needing essential procedures, there are specialized tools like squeeze cages or similar devices that allow safe injection of chemical restraint without direct handling risk. For cats, there's something called clipnosis, using clips on the scruff like a mother cat might carry kittens, which can induce temporary calm in some cats, though its reliability is debated. And don't forget the carrier itself. Using carriers where the top comes off easily, or soft-sided ones for easier sedation administration. And again, that home conditioning, making the carrier a safe space, not just the vet taxi.
Carrier training is huge.
Massive. And finally, for very difficult to handle cats, tools like an easy nabber, which is like a padded net on a pole, or even just a fish net, can sometimes be used to safely capture them from a distance for sedation when necessary.
Wow, quite the arsenal of options. It really shows a commitment to finding less stressful ways.
It does. It's about having the right tool for the job and always thinking about safety and reducing fear.
Okay, so we've talked a lot about what the veterinary professionals can do, the environment, the techniques, the tools. What about us, the pet owners? What's our role in making vet visits better?
Oh, your role as the owner is absolutely vital. You're the pet's main advocate.
So what are the key things we can do?
Well, like we just touched on, taking the time at home well before the visit to get your pet comfortable with things like their carrier and wearing a muzzle. That preparation is invaluable.
Making it normal, not scary.
Exactly. Also, being really open and honest with your vet team. Tell them up front if your pet has a history of fear, anxiety, or aggression. Don't be embarrassed. It helps them prepare properly.
No communication.
Essential. And don't be afraid to discuss the handling plan with them. Ask questions. Share your concerns. You know your pet best.
Be part of the team.
Yeah. And during the visit, keep watching your pet's body language.
Hmm.
If you see those subtle signs of stress starting, point them out. Advocate for a break or a change in approach if needed.
User knowledge.
Absolutely. And finally, maybe consider using calming aids, like those pheromone sprays, in the car or carrier on the way to the clinic. It can help start the visit on a calmer note.
Okay, this has been incredibly thorough. So much practical information. If we had to boil it down, what's the main takeaway for everyone listening?
I think the fundamental takeaway is this.
Mm-hmm.
Really understanding the why, the physiological, the behavioral reasons behind fear and aggression in vet settings empowers both us as owners and the vet professionals. It lets us move away from just, reacting to the behavior and towards using proactive strategies. Strategies that put the animal's emotional well-being and everyone's safety first.
Right. It shifts the focus from control to compassion and understanding.
Beautifully put, yes.
And by applying these ideas, these insights, we can all genuinely contribute to lowering our pets' anxiety and making those essential vet visits, well, just a much better experience for them, for us, for the whole team.
Precisely. Couldn't agree more.
It really makes you think.
Yeah.
If we can make such positive changes in a place that's often inherently stressful, like the vet clinic, just by understanding animal communication and stress better, imagine how applying that understanding could improve all our interactions with our pets every single day.
That's a fantastic thought. It really broadens the perspective, doesn't it?
Yeah.
Taking these principles beyond the clinic walls, definitely something worth mulling over. And for anyone who wants to dig even deeper, especially into educating yourself further, we've put some links to great client resources in the show notes.
Excellent. Definitely check those out.